Hey YouTube, it's your girl Jenny Pooh. Today is July 14th, 2017, which makes me officially 4 months and like a week post-op my revision from the lap band to my vertical sleeve gastrectomy. I wasn't going to vlog today because I missed the 4 month because nothing big and exciting and extraneous is like really happening. But I did follow up with my doctor, not my surgeon. I followed with my doctor today, and stats is nothing really exciting to say either. Like my starting weight was 250. After my liquid diet day of surgery, I was 238, and today I think I'm like 214 or something like that. So I'm not doing the math because whatever. Anyway, so I went to the doctor today to follow up. I was supposed to see her 3 months post-op, but by the time they got me in, it ended up being 4 months post-op. So she made me feel better. She said that my weight loss is right on track. I'm doing great with that. My blood pressure was a little high today, but no one said anything. I noticed it was like 135 over 78, so that top number was a little bit high for me. I told her that she's first thing was like, how are your vitamins going? See, what had happened was, the vitamin situation is helping Lord. But the vitamins I'm supposed to be taking are a multivitamin. I take a Centrum, a D3, a B12, and I'm trying to get biotin in because I'm trying to get these edges, bless the Lord. Anyway, so she said we did blood work today, and so she was like, I suspect your D3 is going to be off a little bit because she hasn't been taking them, but really get those in because they really are going to help your weight loss too. I was like, oh, well, anybody never said that part? Then let me check them down right now. My issue is that I take thyroid medicine at first thing in the morning, and I can't take anything for 4 hours after that. So by the time that 4 hours, we don't forget. So she said just take them after dinner. So I'm gonna really have to figure out how to make myself get these vitamins in. I tried taking them like a couple days ago, and knowing good and well they were gonna get my system enough to show that they were therapeutic levels, but can't blame my sister for trying. I told her I still struggle with water. I said the most I've ever gotten in a day is 48 ounces. And I drink, I use this container, and if I can get through, my goal is to get through at least 2 of these a day, and that's like 46 ounces. Because these are like 23 point something ounces. And I have my, like, Crystal Light type things in them. I told her that I was very shocked that my knee pain has gotten worse. And so, because everybody tells you when you go to the doctor's office, this hurts, you need to lose weight. Everything's about losing weight. So I said, I've lost weight and my knees feel worse. And she's like, I never tell people their knees going to feel better. They're actually going to feel worse for a little bit and then they'll get better because you've lost weight, your body is distributing weight differently, so your knees may hurt more. I said, when am I ever told me that? So I said, I know my surgeon is not harsh on the whole no ibuprofen situation, but he's like, just don't take it on a regular basis. So I had some like 600 ibuprofen left over from some tennis elbow. And I would take them. And I don't know if it was psychological because she was like, it's really for inflammation. If it's really joint stuff, it's not really going to be, it's not inflammation. I need to, hold on one second. Sorry, y'all. Anyway, I'm trying to make this quick. I'm just not going to be a long video at all. So, she suggested that I take quick relief, fast relief, Tylenol. So this is like the Walgreens brand. It's known as backwards, but whatever. So I took 2 of those a minute ago, and we'll see how that works out. Clothing-wise, I've gotten to some jackets that I had that are 12s. I started off at like a 16, 18-ish type situation. I'm a hippier girl. Like, people think my stomach is so flat, and it's so not flat. Like, they were laughing at me today because my hair matches my shirt. I'm gonna show you in a minute. It's so weird. But so you can get a full body shot. Make sure my leggings not falling off. But to get a full body shot, I am a curvier girl, which is fine with me. This shirt used to really fit really tight, but now if I do that, so people think my stomach is flat. It's really not. It depends on what I have on. It may look flat, but it's really not flat. Someone told me the other day, it's like, oh, when you gonna stop losing weight? I'm like, I just got started. Who you talking to? Like, get your life together. It's amazing how people want to tell you what to do with your life. But I told her it's really hard to not compare yourself to other people. It's just hard not to. So I went to a support group. I don't think I'll be doing that again because the support group was about bariatric patients and osteoarthritis, which is what I have in my knee. And the guy who did it, it's the last time I'm going to leave y'all, I promise, because I got something in the air fryer I don't really want to burn up. That's the last time I'm going to leave, I promise. The guy who ran it was a physical therapist, and I'm an occupational therapist, so I was like, hey, we can talk the same language. So it was about 30 people in the class, and I think some people use that class for like their 6-month pre-op. They have to do like classes and things. My insurance company didn't require me to do that, so people were signing up, and you could tell some people were pre-op or whatever. And so this lady was sitting next to me, and she looked like she was about this big. And so clearly she had surgery already. So she's on her cell phone or whatever. And so the nurse that was like running the group too, like helping people sign in, was like, I'm going to brag on you with her. So I think she's like 4 years post-op RNY. Fine, it's good for her. Praise the Lord. I'm happy for you. So, but what I didn't appreciate was her being very judgmental of people who don't have RNY. Like, she said, asked me what surgery I was doing. I said I had a lap band I revised to the vertical sleeve or whatever. And she was like, are y'all all scared of the RNY or whatever? I said, I just didn't. Me. No shade to nobody else. If you had RNY, that's your decision. That's fine. That's not what Jennifer chose to do for her. So I said, well, me personally, the biggest reason I didn't want RNY is I didn't want my intestines rerouted. I didn't want to deal with the malabsorption. I didn't want to deal with some of the things that I know are possible complications with RNY. My choice, whatever. So I said I didn't want my intestines rerouted. And so she was like, well, you was having surgery anyway. I said what I said. And what I said was I didn't want RNY. Like, shut the hell up. Worry about yourself. So, and she was like, yeah, because I was 368 pounds. But now I'm 98 pounds. What? And that's healthy because what? What grown woman weighs 98 pounds? Like, whatever, do you, but if you want me to be 98 pounds and be that thin, then that's fine. I'm really not trying to be judgmental, but I'm never, ever trying to be 98 pounds. Like, that's just not even on my goal radar anywhere. So, the class went on, and he was explaining osteoarthritis, and he explained why when I do weightlifting is when my knees feel better because that pressure is what on the cartilage is what makes those joints feel better. So I was happy to hear that. And this lady raised her hand. She's like, I have fibromyalgia. Okay, we're not talking about that right now. We're talking about osteoarthritis. Like, that's a whole other ball game. And so she's like, yeah, I went walking and I ended up in the emergency room when I was in the hospital for 24 hours and they gave me this medicine and they put me on these steroids and this and that and the other. Was that right? At what point did this man say, first of all, that he was a physician? At what point did we say we're talking about fibromyalgia? So, like, I need you to focus. So I didn't even, so then he finished his presentation. Then one of the surgeons came in and he was doing his presentation about, pre-op and, the possibility that there's a risk of death and all these things and how important it is that you walk. So things that I've already known that, because I've been through that part already, which was fine. But it was like he couldn't get through his whole presentation because people kept asking questions that had nothing to do with what we're talking about. And I was like, yeah, so the support group thing, I don't know if there's anybody in the Chicagoland area that watches my videos that knows of other support groups for patients who've had, vertical sleeves or who've had bariatric surgeries that I don't have to pay to go to because that's part of my program. I'll be interested in hearing other topics because there's a lady I follow on YouTube. Her name is, I think it's Sherry. I should know her name because I watch her videos. But she goes to a support group, and her seems to be very helpful because she comes back and talks about things they talk about in the support group. This one, like, they have topics, but, like, that's the only topic that I felt was relevant to me. So I don't have to do some research and find some other things. So I really do want to be accountable. I really do want to speak with people who understand what I'm dealing with. So I told my doctor that my recovery was a little bit rougher than I anticipated. as you guys know, if you watch my previous videos, like I had the whole constipation situation going on for the first 2 months and irregular with my bowel movements or whatever. And just, she was like, I'm so sorry you had all those complications. And I was like, in hindsight, it really wasn't that bad. At the time, I was like, I'm about to die. But in hindsight, looking at other people that I know have had to have the lap band removed, they had like scar tissue on their stomach, or it had it rolled into their liver, and ended up having to take tube feedings. Like, it could have been so much worse. So I'm very grateful that mine was as minimal as it was, because it could have been worse. So I'm not going to complain about my recovery. But I did tell her about the water, how it's hard to get the water. I think I already said that or whatever. So she just wants me to push the vitamins. Working out, I really did, y'all. I tried a class, and it was just, I think I talked about that in another video, it was just so clickish. I really haven't went back. So I'm going to have to figure out something else about that. So, yeah. But nothing else other than that is going on. I think I've lost a total of, I wish I had my book over here. I hadn't planned on doing this video, so I just jumped on really quick. So I'm going to get a massage that I so need at 2 o'clock. But, yeah, I think I'm around 17, 18 inches lost total, whatever. So I took a picture today, and it's such a mind game that I look in the mirror and I don't see what the picture shows me. So, like, I took a picture today because I was trying to show somebody that they saw my hair and my shirt match or whatever. And my neck and face look so thin to me in the picture, but when I'm looking at myself right now, I don't see that. And if you've had your surgery, you probably know what I'm talking about. And I told the doctor that there are some days I feel like I'm eating all day. Not copious amounts, like large amounts of food, because obviously I can't, but I feel like I'm snacking all day on whatever I'm snacking on, like not like bad stuff, whatever. But then there are days I feel like I don't even want to be bothered with food. And so she was like, yeah, that's kind of really goes with the whole sleeve thing or whatever. I said, but the lap band, it was more that I physically couldn't eat stuff, not that I didn't want to eat stuff. And with this one, I'd be like, oh, did I eat today? Sometimes. And then other days I'm like, So she was like, the surgery definitely affects the hunger hormone. So that's perfectly normal. It happens with this surgery. So I don't think I really said anything, catastrophic in this video, but I feel like I haven't done one in a while. And so I know there are people that I follow that it was kind of disappointing that I was following them, and then they just kind of dropped off the face of the earth. And I was all excited with their journey, trying to see where they went. And then it's like they posted for like 3 months and then just disappeared. China Rain, where you at, girl? And there's some other people that I follow that just kind of disappeared. I know life gets busy, stuff happens, I get it. Well, nothing big is happening, but it's just, you just get you feel a connection with those people because they're dealing with what you're dealing with or are going through it right before you get to go through it. So you look for that support or whatever. So I'm hoping to see some videos drop for some people that I follow soon. And then I feel some people post a whole lot, and I'm like, okay, we just saw you yesterday, but it's your channel. You do what you want to do. This is my channel. I do what I want to do to it. So I think that's about it. Any questions, encouragement, support, which I know about in the Chicagoland area or Northwest Indiana area for patients like us, let me know. Hit me up in the links below. I'll be really appreciative of that. So I'll talk to you guys soon. I may just wait until my 6th month and hopefully have some big great news, like I've hit Wonderland. 15 pounds ago to get to that. So hope I can lose 15 pounds in 2 months. That should be doable, right? We shall see in 6 months, unless something big and catastrophic happens before that. All right, I'll talk to you guys soon. Bye.